Alright, let's get real for a minute. We've all heard the term split personality. Maybe you saw it in a movie, or maybe you heard someone use it to describe a person who seems to change their mood on a dime. But here's the deal. Most of what you think you know is probably just plain wrong. This isn't some Hollywood gimmick or a spooky story. This is a real, serious, and deeply misunderstood mental health condition that affects real people. These are individuals who are struggling, often in silence, with something that happened to them, not something wrong with them at their core. It's time to pull back the curtain and have an honest conversation about it. We're going to talk about something called dissociative identity disorder, or DID for short. That's the clinical name for what people used to call multiple personality disorder. The name change matters. It gets to the heart of the issue. It's not about multiple, fully formed personalities living like roommates in an apartment. It's about a single identity that has become fractured or dissociated. It's a defense mechanism. It's the brain's way of protecting a person from something so terrible, so overwhelming, that they couldn't handle it as a whole person. It's a survival strategy, not a character flaw. I know this can sound confusing. It's complex, and that's why there's so much misinformation. But you know me. I break things down so we can all understand. We're going to look at what DID is, what it isn't, why it happens. We need to replace scary stories and stereotypes with facts and compassion. Behind every diagnosis is a human being who deserves to be understood, to be supported, to have a shot at a healthy, productive life. It's about giving them tools to put the pieces back together. So open your mind today. Forget sensationalized TV shows and movie villains. We're having a real straight-up talk about the human experience behind DID. We'll look at symptoms, causes, and the hope for healing. This isn't about being crazy. It's about being a survivor. Survivors have a strength most people can't even imagine. Let's get to the bottom of what's really going on with dissociative identity disorder. So, what exactly is dissociative identity disorder? Let's break it down. At its core, DID is a dissociative disorder. Dissociation is a word we use to describe a mental process where you disconnect from your thoughts, feelings, memories, sense of identity. It's like your mind builds a wall to separate you from something that is too painful to process. A mild example is when you're driving and you zone out, arriving at your destination without really remembering the trip. With DID, this process is much more severe and disruptive. It's a chronic, long-term coping mechanism that results in a fragmented sense of self. The key thing to understand is in the name identity disorder. This isn't about having many different people inside one body. Instead, it's about one person whose identity never fully integrated. Because of severe trauma in early childhood, the normal process of developing a single unified personality gets derailed. Instead, different parts of the person's identity, their memories, their emotions, their behaviors, get sectioned off. These distinct identity states are often called alters. They are not separate people. They are disconnected parts of a single person, each holding different aspects of their experience. This is what makes DD different from other mental illnesses. While conditions like bipolar disorder involve shifts in mood, schizophrenia can involve psychosis. DID is fundamentally about a disruption of identity. The person with DID experiences these different identity states, or alters, taking control of their behavior and consciousness at different times. The person may or may not be aware of these other parts of themselves. This can lead to significant memory gaps, where they can't recall personal information or things they have said or done. It's a fundamental break in the continuity of their own life story. Think of it like this. A healthy personality is like a finished puzzle, with all the pieces fitting together to create a complete picture. For someone with DID, the puzzle pieces are all there, but they were never put together. They are scattered in different boxes. Each box holds a piece of the person's life. A memory of trauma, anger, joy, a skill needed to function. The goal of treatment isn't to get rid of the pieces, but to help the person slowly and safely begin to put their own puzzle together for the first time. Recognizing the signs of DID is the first step toward getting help, but it's not always easy because the symptoms can be hidden or confusing. The most defining symptom is the presence of 2 or more distinct identity states, or alters. These aren't just mood swings, they are significant shifts in a person's sense of self-behavior, memory, thinking. An individual might suddenly speak with a different voice, use different gestures, or express completely different attitudes and preferences. One alter might be a small, frightened child, while another might be a tough, protective teenager. These shifts can be very disorienting for the person experiencing them. Another huge red flag is severe memory loss that goes way beyond normal forgetfulness. This isn't about misplacing your keys. This is about finding items in your home that you don't remember buying, or meeting people who claim to know you well when you have no memory of them at all. This is called dissociative amnesia. The person might have large gaps in their memory for their personal history, including significant periods of their childhood. They might lose time, finding that hours or even days have passed without any recollection of what happened during that period. This is because another alter was out or in control. People with DID also frequently experience a sense of detachment, as if they are watching their own life from outside their body. This is called depersonalization. They might feel like they are a character in a movie rather than a real person. They can also experience derealization, where the world around them feels unreal, foggy, or distorted. These feelings can be constant or come and go, but they add to the profound sense of confusion and disconnection from reality. It's a constant struggle to feel grounded in their own skin and in the world around them. Beyond these core symptoms, individuals with DID often suffer from other serious issues. Because the disorder is rooted in trauma, they almost always have symptoms of post-traumatic stress disorder, such as flashbacks and nightmares. Depression, anxiety, panic attacks, and self-harming behaviors are also very common. They may struggle with headaches, body pain, and other physical symptoms that have no clear medical cause. Now for the big question, what causes something like this to happen? Let's be very clear. Dissociative identity disorder is not something you're born with. It doesn't just happen out of the blue. Overwhelmingly, research and clinical experience show that DID is a developmental response to severe repetitive trauma in early childhood, typically before the ages of 7 to 9. This is a critical period when a child's personality is still forming and integrating. When a child experiences abuse or neglect that is just too horrible to bear, their mind finds a way to survive. Dissociation becomes that survival tool. The type of trauma is often extreme and prolonged. We're talking about severe physical abuse. We're talking about severe sexual abuse. We're talking about severe emotional abuse. It can also be caused by profound neglect. A child's basic need: safety. A child's basic need: food. A child's basic need: emotional connection. Other causes can include living in a terrifying and unpredictable home environment, like a war zone, or undergoing painful and frightening medical procedures at a young age. The common thread is that the experience is overwhelming. The child has no one to turn to for protection or comfort. They are utterly alone in their terror and pain. So how does this trauma lead to DID? A young child can't fight back. They can't run away. So their mind does the only thing it can to escape. It goes away. By dissociating, the child can mentally separate themselves from what is happening. It's as if they are thinking, this isn't happening to me, it's happening to someone else. Over time, with repeated trauma, these separate someone else's become more defined. Different parts of the self are created to hold the traumatic memories. Different parts hold intense emotions, rage. Different parts hold intense emotions, terror. Different parts hold what's needed to function in daily life, like going to school. It is crucial to understand this. DID is a brilliant creative survival strategy. It is not a weakness. It is a testament to the resilience of a child's mind in the face of the unthinkable. The fragmentation of identity allowed that child to endure the unendurable. It walled off the pain so that a part of the child could continue to grow, to learn, and to connect with the world in some way. The problem is that this coping mechanism, which was so essential for survival in childhood, becomes highly dysfunctional and distressing in adulthood. Diagnosing dissociative identity disorder is not a simple process. You can't just take a blood test or a brain scan and get a definitive answer. It requires a skilled mental health professional, usually a psychiatrist or a psychologist who specializes in trauma and dissociation. The process is often long and careful because symptoms of DD can overlap with many other conditions. People with DID are often very good at hiding their symptoms out of shame, fear, or a desire to appear normal. They've spent their lives trying to conceal their internal chaos. The first step is a comprehensive psychiatric evaluation. A clinician will conduct detailed interviews. They'll ask about the person's history, symptoms, and life experiences. They'll look for key signs: The presence of alters dissociative amnesia or memory gaps and significant distress or impairment. They may use specialized interviews and questionnaires. Dissociative experiences scale. Structured clinical interview for dissociative disorders. A crucial part is ruling out other conditions. Memory loss could be related to a neurological issue. Apparent personality shifts could be misinterpreted as the mood swings of bipolar disorder. Hearing voices might be mistaken for the auditory hallucinations of schizophrenia. In DID, the voices are experienced as coming from inside the head and recognized as the thoughts of the alters. A careful diagnostician will differentiate these conditions to arrive at the correct diagnosis. On average, it takes 7 years in the mental health system before an accurate DID diagnosis. Often they first seek help for depression, anxiety, or PTSD. They may be misdiagnosed several times along the way. Finding a therapist who is knowledgeable about trauma and dissociation is absolutely critical. A correct diagnosis is the first real step on the long road to healing, because you can't fix a problem until you know exactly what the problem is. Let's get one thing straight. The way DID is shown in movies is almost always wrong. That's myth number 1. People with DIE are not violent villains with an evil alter. In reality, they are far more likely to be victims of violence than perpetrators. Most of their struggles are internal, and any self-destructive or aggressive behaviors are often directed at themselves, not others. The idea of a monstrous alter is a harmful stereotype that creates fear and stigma, making it harder for people to seek help. These are not monsters. They are wounded human beings. Myth number 2 is that DID is extremely rare. While it's not as common as depression, it's not as rare as you might think. Studies suggest that it affects around 1% to 1.5% of the general population. That means there are millions of people living with this condition. It's often called a hidden disorder because people with DID learn to hide their symptoms so well. They fear judgment and disbelief, so they suffer in silence. The problem isn't that it's rare. The problem is that it's under-recognized and underdiagnosed by both the public and many in the medical community. So what does recovery look like? The good news is, treatment is available, and healing is absolutely possible. The recommended treatment for DD is long-term psychotherapy with a therapist who specializes in trauma. The goal of therapy is not to eliminate the alters, but to achieve integration. Communicate and cooperate to share memories and skills, and to eventually merge into a more unified and cohesive personality. It's a slow, difficult process that involves building trust, processing the original trauma in a safe way, and learning new coping skills. The journey to healing is long, but there is so much hope. With the right support, people with DD can learn to manage their symptoms and lead full, meaningful, and productive lives. They can build healthy relationships, pursue careers, and find peace. Recovery means moving from being a victim of your past to being the author of your future. If you or someone you know is struggling with these symptoms, please know that you are not alone. Help is available. Reaching out is a sign of incredible strength. It's the first step toward reclaiming your life and becoming whole. You can do this.